Hey everyone, it's Alec again from Home and Rehab, and we're going to do our next section on youth athlete injury prevention on one of the most commonly feared and unfortunately most commonly seen in my clinic injuries that we have with young athletes, and that's an ACL tear. So the anterior cruciate ligament is part of the knee complex that is designed to attempt to prevent your tibia from translating anteriorly underneath the femur. Essentially, when we see this happen most often is not necessarily with contact, but with what we call plant and twist injury, which is when someone literally plants their foot and tries to turn or pivot over it. It puts a lot of tension on both of the ligaments and can cause the anterior ligament to rupture. Now that rupture has a lot of impact on our stability as athletes. It prevents us from being able to land without having a giant wiggle in the knee, which can be very important for our ability to produce power. Obviously, there's a surgery that deals with this. It's a very famous surgery, and it's usually very successful. And our job most often is to try and rehab you back to sport afterwards. In terms of preventing this injury though, there's actually been some great research that shows that if you do the right exercises beforehand, you have less risk of this injury. This is especially a common injury in young athletes who are female because the angle of their hips to where their knee base of support is tends to come at an inward angle that puts them at a greater likelihood to put strain on that ligament in the first place. So one of the things that we like to work on with young athletes who are trying to work on injury prevention is seeing how they land. Athletes who tend to land with their knee that bows inward as they make that first contact have a higher risk of injury. So working on those landing mechanics can be very important. We also look at stability. Patients with better proprioception, who have a better knowledge of how their foot feels when it lands on the ground and how to make sure it doesn't have as much wiggle room in the first place, can really go a long way in this, as well as having appropriate strength in your quads and hamstrings. If we have good strength in the muscles around the knee, those muscles should be taking most of the load when we make any of our landing and pushing maneuvers. Therefore, the ligaments should hopefully have to work quite a bit less, and that theory seems to pan out pretty well when we do our research in injury prevention. We've seen some programs that actually will show a drastic reduction in rates of injury from year to year if one year did these reduction programs and another year did not. So, if you are worried about an athlete in a sport that tends to have a lot of ACL tears, and this can be things like rugby, soccer, football, volleyball, and basketball, one of the things you can do is take them into a local physical therapist who specializes in sport and see if they can give you some ideas of ways you can train and exercises you can do to keep this from being a common occurrence. There's no 100% way to prevent any sort of injury, but with the right landing mechanics and the right strength and stability in your leg, you stand a lot lower risk, and hopefully you can have a lot more fruitful career just by making sure that you're well prepared.